Hello all, and thanks for tuning in again. Today's episode is going to cover vibration and whether or not it can be used to manage DOMS or delayed onset muscle soreness. This has received a ton of attention in research recently, and obviously it's been gaining more attention on social media and things like that as new products have been coming out, and also most recently with the acquisition of Normatec by a company called Hyperice. Hyperice has a number of products. I'm sure all of you are familiar with the Hypervolt, which is a percussive massage gun, but they also have another of other massage or vibration type devices such as a foam roller, something that straps around your back, knee, shoulder, that also apply heat, and just to name a few. So I've had a number of questions about this since the recent merger, since Normatec has been a long-term partner of mine, and I've had a few discussions within the closed Matt Hansen racing groups, as well as direct messages on social media, so I thought I would cover this topic really quickly. I also had a comment on the most recent video that I did asking this, so it was basically going to be something that I could pretty quickly throw together. So the whole rationale behind this is there's basically two theories. You need to understand gate control theory and then understand the pain spasm pain cycle, or otherwise known as the circle of pain. So the gate control theory basically says that a non-painful stimulus can override a painful stimulus. Okay, and so basically if you think about anytime you bump your shin or get bit by a mosquito or get punched in the shoulder, whatever it is, your ingrained response is to rub it, and that makes it feel better. And so basically that is using gate control. So essentially there is a gate at the spinal cord that will only allow one sensation from an area to go to the brain at a given time. So the brain will only process one sensation from an area at a time. Pain nerves travel relatively slowly, and sensory nerves travel really quickly. So by triggering the sensory nerves, vibration, touch, things like that, you're sending a signal that's going to travel faster than the pain signals are traveling in an area, and it's going to get to the spinal cord first, and then it's going to prevent the pain signals from getting pushed up to the brain. So that's how the gate control theory works. So what does that really mean? How does that give us any sort of help? Well, obviously, if you're in pain from the DOMS or just from any sort of pain sensation in the muscular area, providing a sensory stimuli to the area is going to help mask that pain. But as soon as you take that stimuli away, the pain is obviously going to return. So that's where the second theory comes in with the pain spasm pain cycle, or the circle of pain. Basically what this says is pain leads to spasm of a muscle, which leads to reduction of blood flow, reduced circulation, so on, which is going to cause more pain, more spasm, more inhibition, and so it just kind of circles. And you can easily see a visual of this by just going to a Google search and typing in pain spasm pain cycle. Here's an example of one that I pulled off really quickly. So you can see by this graphic that pain or stress can cause muscle tension, and that muscle tension can cause a decrease in circulation, which increases pain, which causes even more tension, even less circulation, more pain, so on and so forth. And that cycle will just continue going on. And so you need to be able to interrupt this cycle in some way, shape, or form. You can do this with vibration. So clearly there are other things that you can do to help interrupt this pain spasm pain cycle, and you don't just have to use one. Non-steroidal anti-inflammatory drugs or NSAIDs, such as Aleve, ibuprofen, that type of thing, are definitely one option. I personally don't like to use that whenever possible, but definitely something that should be in the treatment toolkit. Hot and cold therapies have been well researched in this area as well. Massage certainly has been looked at extensively as well. The question is, though, does vibration actually work? And is it supported in recent research? And the answer to that is, well, yes. Actually, there's been a pretty big uptick in the last 5 years on vibration therapy and whether it does help prevent DOMS or reduce the symptoms of DOMS. And that's largely because of the popularity of these new products that have been on the market. So there's been quite a few high quality studies. One 2004 meta-analysis suggested that vibration therapy and massage were both equally effective at preventing or dealing with DOMS treatments, or DOMS symptoms, I'm sorry. Another suggested that the vibration or the percussive therapy has shown to improve athletes' overall performance with just 5 minutes of treatment. All right, so there are some definite benefits of vibration. Obviously, you can have the whatever device you're using. You can put it in a localized area. If it's like the percussive gun, like the Therabolt, you can really work just the specific muscle. There's a number of ways that you can exchange the head on the gun to best suit your individual need. There's also some ways of combining methods. Some of the vibration things have heat as well, which can also help increase the circulation at the same time that it decreases pain. So you're trying to essentially attack two areas on that pain spasm, pain cycle. All right, but overall, the general consensus is that yes, it does work, and it is definitely recommended to have some sort of way of using that, using vibration in your treatment of DOMS. Thanks for tuning in again, and hope to see you back next time.